Today I want to talk about the beautiful intelligence of the body and how the body can serve as a library of information about past trauma. Now, we talked about trauma that can be passed, what we called about intergenerational or even transgenerational trauma. So intergenerational trauma is from our parents, right? That's like one generation. And then transgenerational trauma is more than that, right? So multiple generations where that lineage trauma can actually be passed down. But I want to talk about actually this beautiful intelligence of the body related to our development. So when we come out of the womb, we have all these beautiful organs, right? And so we know that they have not been fully what we would call developed. And even in modern medicine, we know that. So it takes a while, right, for certain organs to fully develop, like our immune systems to have a true, like what we call an adult immune system. And also that's, if we think about organ development, like we don't give children water, right, when they first come out. They can't do that. It actually would be very, very damaging and dangerous. And so we realize that the kidneys actually need time to develop. Now, what happens is, what if an actual trauma occurs when a child is 7 years old? Well, that's in the midst of certain types of developmental stages. And so if we think about that, if a trauma occurs at that period of time, that may be the most vulnerable organ, and that is what we see. So let's say, for instance, the system that was impacted, maybe when someone lost a loved one, let's say they lost a parent and they were age 5 or 6 years old. Whatever organ system is developing and becoming more and more mature during that time period, it might be thwarted. Makes sense, right? Well, then, let's say, for instance, they have years later, they're having issues with that same organ system because it's more vulnerable. So this is really important for us to understand that even in modern medicine, they may be chasing after a certain organ, let's say the thyroid, right? Well, what if that thyroid was impacted during that development when a child had a trauma? So we have to go back and actually help support that developmental phase and the phases that then come after that. So it's really beautiful to think about in these different perspectives, these different medical perspectives, that again, trauma doesn't just happen and then it doesn't affect the physical body. It can in many ways. We have to think about our hormones and even our neurotransmitters, which are our brain chemicals, are communicators. And if there's something that someone was not able to resolve in their present time, we don't want them to keep having that happen. We also don't want them to pass that on to their children. Makes sense. So what we have to do is be even more specific and to have even more compassion for what's going on for a person. So many times I have people coming in and like, as we talked about thyroid, so many thyroid issues, right? People come in and I'm like, oh my gosh, it's my thyroid. I have this, I'm losing my hair. My nails are weak. I'm having palpitations, or maybe I'm so tired. I can't sleep. I'm like wired and tired. And we have to go back and look at that social history and see if there's anything that happened around that developmental phase of the thyroid. And then we have to go in and be more supportive around that, but we can't just always think about it's just medication. There's other pieces that have to show up. So this is where other things can be helpful, other therapies. People might do meditation. Some people may also they may actually do counseling to try to help with that. Maybe they never dealt with it until they deal with it. The thyroid is not willing to kind of cooperate. And again, it's not that our bodies are turning on us. They're trying to provide information, right? And so if there's something that needs tending, instead of it becoming more and more of an issue to where there's more damage to other systems on top of that, that were later developed, we don't want that to happen. That we're trying to prevent disease. We don't want to just cover it up. So if you're having issues related to a certain kind of illness or disease and you're not getting the answers that you want, we may want to go back to the developmental phases of maybe what's happened throughout your life and see if that might be part of it. And if we don't work on that, we're not really going to get very far. All right. Wonderful being with you guys today. If you have any questions, feel free to leave them. We will get back to you, and please stay tuned. I have more to come.